right there. Oh, here, darling, here. Yeah.
Don't touch my nipple.
Here, sweetie.
Stop tricking her.
Yeah.
Hi, welcome this week to the Naked Doctor. I'm Dr. Tammy.
I'm Lauren.
We have a great show for you today. The Baby Show.
The baby show.
And why are we calling it The Baby Show?
Why would we talk about a baby?
Lauren has a little announcement.
Well, all right. So about 10 years ago, just a couple days past, it was about exactly 10 years, I had a baby. And I decided that, it's about time. It's like a decade now, so it's about time to have another one.
So I'm pregnant. No, I'm just kidding.
She's caring for me. No, I'm carrying her baby. No, it's okay. It's mine.
That's going to get people talking.
But no, it's my baby. It's my baby.
Yay,
Yes, we have a baby on the way, so it's a official announcement there. So yeah.
Awesome. So we thought we would talk about all things baby and hormones. And over the past few decades, I guess, with my own fertility problems, and I have my son who's 14 now, but I had fertility issues for almost 13 years, and it's quite significant for a lot of people. And so that's one of the things that we do here is help people with their hormones. And you didn't need any help. Your hormones were good, but a lot of people do.
Well, and however, there are things that when you are pregnant that, your hormones are going crazy and make you kind of just pass out in the middle of the workday. And, there are supplements and stuff like that you can take, and vitamins that will help you with your energy level, and vitamins that are good for you and good for the baby and stuff. So that's been something that's really helpful, being around you and your expertise, helping me kind of be able to literally keep my head up, during the day, because I've been exhausted.
And we need you. So we gotta keep you on your game.
Right. Awesome. Well, let's do that.
So we're going to talk about some different hormones of pregnancy and how some of the pregnancy hormones can affect you even in perimenopause, menopause, all walks of life for women and men, because men and women have all the same hormones. So we're going to talk about all of that and more. We'll be right back with the Naked Doctor. Hi, welcome back to the Naked Doctor. I'm Dr. Tammy.
Lauren.
We have a great show for you this week. The Baby Show.
We're talking about babies.
Talking about babies. We're so excited.
Mm-hmm.
Yep, we're going to have a little one around.
Oh, yes. I'm going to... The baby's TV debut will be on the Naked Doctor.
Oh, that would be so
That
awesome.
would be really cool. Okay, we'll do that. It won't be till August, but
Yeah.
maybe September. It just depends on when it decides to come out, but all right.
Little plug for our art lady here that does our art classes here. The baby picture in the background, by the way.
Yes. It might be a little too zoomed in to see the whole thing, but in the first segment you saw it, though, for sure. She's amazing. She does portraits and stuff like that, so you can go on our website to book her for stuff like that. So
Yeah, very fun. We do a lot here. We've talked a lot about different aspects that we could do around babies and hormones and stress. So we have so many things that are probably going to spin off of this topic. But I think the most significant thing that we can talk about hormones that is the most sort of encompassing, that kind of hits women at all walks of their life and men too, is the hormone progesterone. And progesterone is a precursor hormone that men and women, we all have the same hormones. It's just different percentages and ratios. And the word progesterone means progestation, which means pro-pregnancy. Gestation means pregnancy. And it is the main hormone of sleep. And it's not only the hormone that helps build up the lining for the baby to live in the uterus, but it regulates the sleep cycles, which are so important. And you've already experienced that, being extremely tired this week. You have a lot of progesterone.
I was about to ask you if that's why I've been so tired, because is that what happens when you get pregnant? Because I know, like, I've heard in the past that I've known women who have had issues with their pregnancy because their progesterone wasn't high enough.
Right.
And I know from working with you and stuff that progesterone is the sleeping hormone. So I didn't know if it was because mine's like on overload right now, that it's almost like just knocking me out.
Yeah.
Is that kind of what's going on?
And the fact you're tired, says that you have a lot of progesterone around, which is good. Which the converse of that is people that are not sleeping well, their progesterone levels are probably low. And as we age, as we get into menopause or perimenopause as females and as males, our progesterone dips. And that's such an easy thing to fix. Just got to check levels, see where they're at, and then make recommendations. And you can use natural supplements. You can use bioidentical hormones, progesterone, to fix that, essentially. And you start sleeping better, it affects every aspect of your life, your stress levels, your weight, so your metabolism is all wired around your sleeping.
But somebody basically fixing their progesterone, they're not going to be tired like I am through the day, right? Because I know the progesterone is making me tired because it's so high.
Right.
But typically people aren't sleeping, so they're tired. So their progesterone raising is going to help them sleep better, which during the day will help them have more energy, not be tired.
Yeah, right.
Okay.
So I have a little trick with that. So if I'm going to give somebody progesterone or prescribe them progesterone, I have them take it at bedtime. Because the half-life of like a kind of concentrated dose, if you use it like orally or in a sublingual under the tongue or something like that, is about 12 hours. So that's perfect if you take it at bedtime, you rest really well, and then it's wearing off by the time you wake up.
Unless you go to bed really late. So, if you have to wake up at 6 to go to work, I would take it at like 6 at night or 7,
yeah, right?
right?
Well, yeah. That's all different for sure. But yeah, super powerful hormone, and it makes all the difference if, you're having fatigue issues. The other thing is the thyroid and estrogen levels and all that are all, kind of circling the drain around progesterone too. So you have to balance all of those as well to get, your maximized metabolism effect and things like that. So, but progesterone is pretty huge.
Is there anything else any other indicator that somebody's progesterone might be low besides not getting enough sleep, besides getting insufficient sleep at night?
Weight gain, mood imbalances. And again, it's about checking all the hormones. That's one of the things that we do is we balance all the hormones. It's not just like if a woman's having hot flashes, give her estrogen. I mean, that just does not make sense when there's so many different hormones that are affecting all the different aspects of every different process in your body.
Yeah, that makes sense.
So actually, if they're, I don't have a whole lot of patients anymore, just because we've kind of moved in more to
post baby.
Post baby and menopause, and I think that so many women think that as far as fertility goes, that it's kind of like in medicine. If you have issues, you go to the traditional doctor and you get the pill for an ill, we call it. Or, it's like you kind of get in that hamster wheel. So we think that if you have something or you're sick or you're not feeling well, you go to the doctor, and it's a little frustrating because there's only that world that we know about, which is how we're so different. We do things very differently. But one of the things with fertility or infertility is that people think that if you have fertility problems, the only way to have a baby if you have fertility problems is to go through those expensive
in vitro or whatever
in vitro fertilization treatments, and so there are so many other options that people don't know about, and people are a little resistant to that because they think, well, why doesn't the traditional medical world know about that? And so that's, as I was doing my research with my own fertility issues, I wrote this book. So a little plug for the book. It's 100% natural, baby, and you can get it on Amazon. So if you know anybody who's struggling with fertility, and it's very common, about 1 in 3 couples at some point in a relationship of childbearing age will struggle with fertility at some point or have some challenges. So it's a significant issue, but it's kind of just something that nobody wants to talk about. Nobody wants to place blame. Is it the mom's fault, the dad's fault? What is it? But it's really so easy because it's a progesterone deficiency, and then there's a genetic component, and then there's different nutritional components as well. So I talk about all that in here. If you want to come, talk to us, so I can explain it more, and we can do some hormone testing and see what's actually going on.
So what was your ultimate once you, what was your solution to your fertility issues? Like, what allowed you to actually end up getting pregnant?
Progesterone.
Wow, it's crazy.
Mm-hmm. And then understanding, because I'd had a pretty late miscarriage at about 3 months, and so I was terrified. I was terrified to get pregnant again, and so I was not going to get pregnant again until I knew what was causing that, because that, for anybody who's had a miscarriage or been touched by a miscarriage, it's absolutely horrible
traumatizing.
Traumatizing. And so as I started to understand the genetics and B vitamin metabolism, which is, we talk a lot of,
we could do MTHFR.
Yeah, the MTHFR. Okay. We could do a whole show on B vitamins like B9 and folate. It's fascinating, and one of the things was, if I do get pregnant again and I have the progesterone to maintain the pregnancy, I don't have miscarriage. So understanding the B vitamin metabolism, the MTHFR, was all super important for me. So that's just part of what I do when I work with people for natural fertility, which 100% natural baby, right?
Yeah. So basically, people who have had several miscarriages, you would even through in vitro or other things like that, you would recommend coming in to run hormone tests and everything.
Absolutely. Yeah. Which they just don't do. I mean, they might check some progesterone levels like after you get pregnant, and then make sure that there's enough to maintain the pregnancy, but you have to have that base healthy, balanced level to get there, and then you have to maintain it. So it's interesting. Progesterone is a hormone that's found in birth control pills. So the difference between the synthetic version and the what we call bioidentical version is that the synthetic version, like in a birth control, can actually kill a baby. And the natural
what's in a birth control?
Right.
Okay.
And the natural progesterone, which is what I use exclusively in all my patients, actually can promote a pregnancy.
Wow.
So the chemical structure is very, very different. So one of the things that comes up a lot with hormones is people, say, well, they think hormones are dangerous, and they think estrogen, they think breast cancer. But when you use the natural hormones, it's a completely different chemical structure. And a lot of people don't understand that, and they're terrified to get help with their hormones because they just don't understand that it's apples to oranges, and they don't have to suffer, and they can use natural stuff. And
so technically, because sometimes you'll read on birth control pills or even the morning after pill or whatever, it says like if you are pregnant that the pill is not going to hurt the baby, but really if there's the synthetic progesterone in that pill, it could affect the baby.
Well,
right?
The morning after pill is usually high dose estrogen.
Just high, okay.
So it's just causing that to slough off.
But if somebody kept taking birth control and they were pregnant and not knowing that they were pregnant, could that birth control affect their...
Absolutely.
Okay. Interesting.
Yeah. All things hormones. Yeah, and they're a completely different structure, which is one of the reasons that the pharmaceutical companies can actually patent different birth control pills and different hormone replacement therapies and things like that, is because they've changed the chemical structure.
Wow.
So it's kind of a money greed game, which is kind of
Isn't
sad.
it all?
Yeah.
Isn't everything? It's unfortunate, but it's good that, with you going through your own personal, fertility issues, which, that doesn't happen by accident, and you being able to look into that and everything is beautiful, because now you can, help really pass the knowledge that you learned in that process and help other people, get pregnant and stuff, which is beautiful.
Yeah, I always say things don't happen to us, it happens for us. So everything that I've experienced has just been one more opportunity to be able to help people through what they're going through and help their process along as well. It's probably time for a little break, isn't it? We're going to take a little break and we'll be right back. Naked Doctor. Hi, welcome back to the Naked Doctor. I'm Dr. Tammy.
I'm Lauren.
We are doing the baby show today.
It's a baby. We have a baby on the way.
A baby on the way.
It's just brewing right now. It's just it's attaching to the walls.
It's so funny at this aspect in my life. The thought of having a baby at I'll be 50, my next birthday, is just freaks me out. But the fact that you are I could be your mom, right?
Yeah.
So, this is my grandbaby, right? So I'm super excited about that.
Aww. And you are the same age difference as me and Hayden.
I'm to be all things grandma with this, so I'm super excited
I love
about
it.
that.
And I love how you were like, hey, if you want me to be in there to help the delivery, I was like, yes.
Yes.
Absolutely.
Knocking the doctor out of the way. I'll be like, I'm
Let me
doing
get
this, baby.
We'll do a whole show on it. How to deliver a baby.
I know some people forget that I'm a real doctor, and like I delivered like 200 babies for my residency program, and they're like, "What? You deliver babies?" Yes.
What do you mean you are like a doctor?
I'm a real doctor.
Something that I learned, from one of our shows, we were talking about supplements and everything, and I know that when you first get pregnant, one of the things that they tell you to take is folic acid, and it's like folic acid, folic acid, folic acid, and so I had a huge eye-opening, awakening, whatever, when you started telling me, just you broke that down for me and what exactly that is and synthetic and all that stuff. So I think that's super important information that we should definitely talk about.
Well, and me, I can go on my soapbox forever. We probably should have done a Blackboard segment on this, but I'll try to keep it as brief as possible, right? My long story short, that never happens. But one of the things that I especially kind of have dissected out in this book, again, another little plug, but it's good information in 100% Natural Baby, is that one of the things that comes up is genetics are a huge component of the way our body processes things, right? We know that. And there's epigenetics, which affect your environment, is almost 99%, which turns the genes off and on, which is backwards from what everyone has always said. Well, I'm overweight because I'm genetically, it's in my family. That's not true at all. It's the environment that turns those genes on or off. So one of the things that I came to understand was that there is a metabolism defect that we used to think was rare. It's actually quite common in the way you metabolize your B vitamins, specifically B9, which is folate. And kind of the story goes that around 30 to 40 years ago, our food supply changed and we stopped getting a lot of green leafy vegetables in our diet. And the word folate, or B9, comes from the word foliage. So they started seeing all these other gene defects, like birth defects, like spina bifida and things like that. So when they started assessing what the problem was, they knew it was a folate deficiency. So they said, well, it's too expensive to put folate in the food. Might as well give them vegetables. Let's fortify. Fortify means put junk vitamins back into stuff with folic acid. Well, folic acid is the cheap synthetic version of folate. And if you have this gene defect called MTHFR, sounds like a bad word, right? It stands for methyl tetrahydrofolate reductase, which is...
Say that 5 times
yeah,
fast.
I'm not going to. It's just a big word for an enzyme that metabolizes your B vitamins, basically. And if you have that defect, you can't metabolize folic acid.
Which I have two. I have two of the... I was on my genetic...
right, we did your genetic
yes,
test.
I had two
copies.
2 copies of it, yeah. Which is, crazy. I would have never known that.
Yeah.
So I'm not getting my folate unless I'm taking a folate supplement.
Right.
Yeah.
And unfortunately, all the prenatal vitamins have folic acid in them. And so what happened was, we started seeing less spina bifida, but now we're seeing more autism, more ADHD, more diabetes, more other disease processes, epilepsy, seizures, all things that are related to the problems with this defect, weight gain, obesity. We're seeing all sorts of issues with all things metabolism that are dependent on the B vitamins, basically. So I like to describe it as that ABC gum, already been chewed gum. So folate is already processed B9 or folate, folic acid.
Which is good. ABC folate is
already
good.
Been chewed folate. Yeah, you want the folate. So folic acid is a problem if you have that gene, and they think up to 60 to 80% of the Caucasian population does. So it's a pretty good bet that you have at least one copy of the genes. So folic acid is not what you want, but folate is what you want. And it's funny because people don't know the difference even in health food stores, because we had run out of our folate. And I went to a local health food store, and the lady's like, hey, can I help you? And I'm like, yeah, I'm looking for the folate. And she picks up a bottle of folic acid, and she goes, here you go. And I'm like, no, not the same thing. Oh, yeah, it's the same thing. It's the same thing. I'm like, you don't want to get in a fight in the store, but I'm like,
when it just shows you that's what they're taught.
That's what they're taught.
Yeah, and also like the folate. So like on this one, it says on our vitamins, it says folate by it's out of something different than
Yeah, it'll either be like calcium folinate or
metformin
metformin
or methyl hydrofolate.
That's the ABC already been issued part. It's already processed.
Because can't there be another type of folate that's not based out of those?
There are different folates, yeah.
So would you recommend that one over?
This one is the best one.
Okay.
This is in our supplements. So our multi-metabolic packs, which are the bomb, are what we use for all our metabolism patients that are having problems. But this is like the best prenatal vitamin that you could get because it's not got folic acid. It does have the folate, and then it's got all the other stuff that helps.
And it's not just a prenatal vitamin. It's a
right. We
use
it
for everyone.
We use it for our metabolism patients.
But yes, but this is what I've been using for my prenatal because it has everything I need plus an additional L-methylfolate supplement just to make sure I'm getting that folate because I have both of the MTHFR strands or the genetic defects. But would you recommend, like, are the other ones good also, the other folate, but this one is just the best? But like anything else that says folate in it, like not folic acid, but folate, are they also good for you, just not as good as this one?
Well, there's different steps that the folate has to be processed through. So when you see like L5 tetra, it's like all the different process steps.
So the 5 is?
Yeah.
So it's going through 5 steps.
Right, 5 steps. So this is the most
processed,
ready. And I hate to use the word processed because people think processed bad.
Right. Basically, your body doesn't have to. Your body doesn't have to
process
it.
it. Yeah. Not like processed food. Your body doesn't have to do anything with this. It gets right into the cellular DNA and the metabolism and does everything that's supposed to do. Or if you have a baby, it gets right into the baby's DNA and gets in there and does all the things that baby needs for developing all things baby. Right.
Yeah.
So this is. Little bit different play on terms for processed, but it is the most usable form.
Gotcha. Cool.
Yeah. So super cool stuff.
Mm-hmm.
But again, everybody walking around with this defect, that also leads to aging, diseases, cancer, heart disease. It's funny because folic acid actually accumulates as something called homocysteine, which is a very inflammatory protein in the body. And it's thought that homocysteine is one of the number one markers for heart disease. So when I actually started learning about this genetic defect, I had a lady come in one time and she had like 13 miscarriages. And she'd had 2 babies born full term, but they both died with problems. Everyone in her family had died in their early 50s on her dad's side of heart disease or strokes. And it was like, that's how I started learning about this because I'm like, what the heck?
Yeah, what's going on?
And they were like, oh, it's just, bad genes. I'm like, okay, well, what are those bad genes?
Right.
So I wanted to know that. So as I started studying that, there's an extensive amount of information out there on the net now about this stuff, but at the time, you couldn't find anything. And so, as I did my research, this is probably about 15 years ago, I actually started looking into this. And it's just mind-blowing, all the far-reaching effects from that defect. And one little supplement, methylfolate,
eliminates all issues.
All of it. Unfortunately, though, if someone's having fertility issues, which is one of the things I have in the book, you're going to have to go through your food sources and remove foods that are fortified with folic acid because it's everywhere and it's in everything now. And it's fortified in bread. It's fortified in just about anything that if you read a food label on a bag of Cheetos, it's probably got folic acid in it. So you can't eliminate all of that, but if you're trying to get pregnant, I will tell my fertility patients, you're going to have to go on a folic acid hunt, basically, and eliminate everything that you possibly can. And I have had patients that have gotten pregnant after multiple failed in vitros. So this is not just, this is science. And it's so sickening to me. It's kind of like the cancer industry or the traditional medicine industry on any level. It's so sickening to me that we have so many natural options and people just don't know about them. So it's like, I don't know, my soapbox, that's what I do. I get outside the box and help people very uniquely and differently. But
so basically, if you've had issues like that, we would love to help you. Come in and get your hormones checked and go through that process of figuring out what the actual root issue is of why you can't get pregnant, and get everything level so you can actually get pregnant and stay pregnant and have a healthy baby and not be worried about all the, not be on a freak out, pregnancy ride like I'm sure that a lot of people are whenever they have had multiple miscarriages and stuff. So.
We even talked before the show about, what's the right time to tell everybody, because you're not that far along. But it's like, to me, knowledge is power. I know you're doing everything that right, and you got all your, I's dotted and your T's crossed. And it's like, still, you can't always guarantee everything, but I am so confident that you are going to be fine that I'm like, we had that conversation. I'm like, anytime's the right time because we're good. But, it is because of the unknown, the fear that people don't know. And that's why they step into this and they feel like it's, like roulette. They just don't know the variables.
And it's hard to be vulnerable and put yourself out there. And then if something did happen, to deal with the, all of the, like everyone knowing that happened, because it's already hard enough to go through it. And then if you have a miscarriage and lose a baby, it's like that, it's really hard to deal with, and it's sometimes you just want that to be a private thing, so it's like, okay, let me not put it out there too early because of the risk of that happening, and but it could happen at any time.
And the reason that happens so early is because those metabolism things in the DNA, that it's so critical at that developmental point. So that's why this stuff we're talking about is so important. And that's what I'm saying is you're covering your bases with all that. So knowledge is power. And it's like so many people don't know the effect their hormones have or the effect that supplements have on things. And so they're just sitting ducks. So again, knowledge is power. And when you have that, it changes everything, which is why we're different. The way we do things is we educate, and that's what the show is about, right? So we want to empower you, because when you have that power, it changes everything.
Totally. Yep.
All right, Thursday, it's time for a little break. We're going to take a little break, and we'll be right back with the Naked Doctor. Hi, welcome back. Thank you for watching the show. This week we've had a great show, and we announced Lauren's baby. Yay!
We've got a baby coming.
So
as my belly gets bigger, that's why.
Yeah. Oh, yeah, that's going to be great because she's always so skinny. So go on our Facebook page, The Naked Doctor, and congratulate her. And check us out. Give us some comments, any ideas for shows you'd like to see.
And if you have any questions about fertility or anything, or want to get in to talk to Dr. Tammy about infertility issues that you're having, this is the right place to do it, because she's gone through that. She wrote the book on it.
Been there, wrote the book.
And super helpful, and will empower you with all the knowledge that you need to really get on track and have the best opportunity to have a successful pregnancy. So.
Yeah, and all things hormones, because it's hormones are hormones, right? So once you understand that, it can help with perimenopause, menstrual irregularities, men with hormone problems, and men have progesterone too, right? Low T and low progesterone, and all the other hormones as well. So,
or even things right after you have a baby and getting your hormones back into balance, because that's one of the big things. We should do a show on that next week.
We should, yeah.
Okay.
You heard the term postpartum depression. That's when the progesterone dips and then depression kicks in and all sorts of things. So yeah, that's
more really on that next week.
And, postpartum depression, or that low progesterone, can go on for years. And then that's why a lot of women gain that 50, 60, 70 pounds after their second pregnancy and not after their first. And they have problems with hormone issues and depression and things like that a lot of times
we
after.
Definitely talk about
that. Yeah, it's a big deal. It's a big deal, but so fixable.
Yes.
Not from a negative place. So Instagram, healingartcenters.com. Check us out. Come see us. Love to help. And have a blessed week. And we'll see you back here next week on The Naked Doctor.
Thanks for watching.